Good morning, good afternoon, and good evening, social marketers around the world. My name is Win Morgan, and as president of the International Social Marketing Association, it's both my privilege and pleasure to introduce the 22nd in a series of webinars designed to advance social marketing teaching, research, and practice. I'm here today with Jay Kassir, our organizer of the webinar series and chair of the ISMA membership committee of our board of directors. Hi, Jay.
Hi, everyone.
And we've got a great webinar in store for you today, and actually a very timely one. We'll begin in just a minute, but before we do, I'd like to share some timely updates provided through the International Social Marketing Association. And that's Jay, by the way, those of you who haven't yet met him or seen his smiling face. I'm pleased to announce a formal alliance among major social marketing associations around the world, including the Australian Association of Social Marketing and ISMA, the European Social Marketing Association and ISMA, and the Pacific Northwest Association and ISMA, and the new Social Marketing Association of North America and ISMA. All of them have joined through the ISMA umbrella to become a formal federated alliance of social marketing associations around the world. So thank you very much, Social Marketing Association of Europe. Thank you so much, Pacific Northwest Social Marketing Association. We love you. And Social Marketing Association of North America, which is soon to have their own logo. Thank you so much. And don't think we're forgetting the wonderful AASM, Australian Association of Social Marketing. All together, with ISMA, we're bringing you social marketing around the world. And mark your calendars and save the date for the World Social Marketing Conference, which will be held in the United States, 16th and 17th May. A discount is available for ISMA members and all those affiliated associations, and it's being offered this time. Simply go to isma.memberclicks.net or i.socialmarketing.org and look on the marquee, and you will see the code for getting your discount for the World Social Marketing Conference. And we've had more than 200 papers submitted this year, which is a record. So I think this is going to be a really important and wonderful conference. So make sure you go and you tell your friends about it. If you want to know what other events are going on in the world of social marketing, just go to i-socialmarketing.org and see our event calendar, which Jay and his friends keep up to date, and you'll see everything that is going on. Thank you very much. And without further ado, I'd like to turn the webinar over to our moderator, Jay Kassir. Jay?
Thank you, Win, and welcome everyone. I want to remind you that if there is more than one of you at your location, we'd appreciate it if you would let us know how many you are using the chat box. That's the only way we know how many we reach. Also, please ask questions using the text box as they come to you. Don't wait until the end of Nancy's talk. She'll answer your questions at the end in roughly the same order that they came in. I have some polls for you. We'd like to find out how you heard about the webinar. If you could click on the boxes and let us know, that we'd appreciate it. So a fair number of people hear about it from our mail. LinkedIn, glad to hear it. Okay, great. And some other. So whoever put in the other, maybe you can actually let us know what that other is. Also, we'd be interested to know which area of the world you're in today. So if you can go ahead and let us know that too. Okay, we're having people putting it in. So we have some folks in Western Europe. We noticed that it must be getting a little early for you there. Most of us in North America. Okay, great. Well, we're glad to have you with us. So, And now it's my pleasure to introduce our speaker, Nancy Lee. Nancy is the founder and president of Social Marketing Services, Inc. She has more than 30 years of professional marketing experience in the private, not-for-profit, and public sectors. She's co-authored 9 books with Philip Kotler. You'll know the Kotler-Lee textbooks, for example. She is an adjunct faculty member of the University of Washington Evans School of Public Affairs. She conducts seminars and workshops and has had many speaking engagements on social marketing and marketing in the public sector at conferences, coalition meetings, and workshops. She's president of the Pacific Northwest Social Marketing Association and a member of the board of directors of the International Social Marketing Association. She's an inspiration to those who've been touched by her. And other than Doug Mackenzie Moore, I would say she and Craig LaFay are in the top 3 of people who've influenced me the most as a social marketer. It's my great pleasure to present to you again as an ISMA speaker, Nancy Lee. Nancy, over to you.
Thank you, and I will advance. Do I have the slide? Okay, good. I see it here on here. Well, first of all, thank you, Wynn and Jay, for continuing to do all of this to organize these webinars for everybody. And greetings to those of you who are listening in from Seattle. I'm here in Seattle, and I just wanted to say hi to you. I see North America and Western Europe, I think. Did I see? Okay. I just want to tell you that what my intention is. My intention is that with this presentation, I'd love to inspire people to advocate with policymakers to consider social marketing as an approach to citizen behavior change. And I'll talk about what I notice that policymakers tend to do now and how I really want to inspire people to advocate for social marketing approach to behavior change. When I talk about policymakers, for the purposes of this webinar, I'm referring primarily to elected officials, government agency directors, program directors, and also at the federal as well as local levels. And so let me go to the next slide. Okay, now I think I've got it. So for the next 35 minutes, I want you to pretend that you are actually one of those policymakers, and I want you to listen to me as if you are. And then that way, someday when you're talking to a policymaker, you know how they will hear this. And so my intention is then for you to pretend that you're just one of them for the next 30 minutes or so. So when it comes to citizen behavior change, traditionally policymakers use one of 2 approaches. They either use education or /information to get people to change behaviors, or if that doesn't work, like if buckle up doesn't work, then we go to a law like click it or ticket. What I want, and what I bet you do too, is for them to consider a 3rd option, social marketing. Many of you may have seen the diffusion curve that has been developed and shared, I believe, around the world. We use it a lot here in Washington State, and one of the things that we like to explain is that the approaches that I just mentioned, that the show me approach, which is usually for education, is for people who all you have to do is show them and they'll do the behavior. If we were looking at the diffusion curve, that would be the innovators and the early adopters. On the far right-hand side are the people that they're not interested in this behavior that you've been talking about. They have no intention in doing it, and the only way that they will do it is if you make them. So that's when the laws come in. The issue is that for a majority of behaviors that social marketers get involved in, the largest group is a group that has some interest in the behavior, but they've got a barrier or they don't see the benefits. And what our job then is to do is to help them. And so we call that the Help Me group. So social marketing is for the Help Me group, education is for the Just Show Me group, and laws are for the You're going to have to make me group. So in this last year, Nancy Hardwick, who's with Hardwick Research here in Washington State, helped me conduct a survey, electronic survey, because I wanted to find out what the current awareness of policymakers are of social marketing. Well, we sent out, we had a 3.3% response rates, which isn't bad when you're going to a large group like that. But what was nice was that it represented 44 states, 176 state, House, and Senate legislators, which is what we targeted, and 82 mayors. And so what we wanted to know is when it comes to citizen behavior change benefiting society as well as the individual, what was their level of awareness of the term social marketing? What was their understanding of what it is? What strategy do they use the most and the least? And what would make it more likely they would use it? So one of the questions that we asked was, how would you describe the term social marketing to someone who asked you? And what we got back from Nate, and it probably won't surprise many of us, was that it's a campaign that uses social media, and this is open-ended. Over half connected it with social media. Only 13% said in some words that it was a campaign to change behaviors, and many of them even used the word greater good. So we had about 13% who seemed to have some understanding of what it is. Then we defined it, and then we asked, of all of these, what do you use the most frequently? Education, information, they say. That's what they use the most for citizen behavior change. And then after that, we have the increased enforcement, which would be different than a new law, but increased enforcement, change in policy, 35, new law, 22, social marketing, 22%. So this gives us it is probably not surprising to me, but I really wanted to confirm what many of us had already worried about and were concerned about was true. Here's the most important question that we got out of this, was what would make it more likely that you would support a social marketing option? Well, they said evidence that it works, 66%. A favorable cost-benefit analysis, 47%. Case studies featuring success stories, and confidence that their staff could actually develop a successful effort. That is what has inspired some of the content of this seminar that we're doing, because I really want that to be available to you, that you can also use this in your discussions with policymakers. So very quickly, the issues that I'm going to explore that we'll share with policymakers that you'll be in the next 30 minutes are issues improving public health, increasing public safety, protecting the environment, engaging communities, enhancing financial well-being, and increasing academic performance. So I'm going to give a case for each one. They represent wicked problems to illustrate. There's some I'm going to represent with heroin overdoses, property crime, single-occupant vehicles, pets in shelters that are euthanized, homelessness, and college enrollment. So those are the case examples that I'll use to share this Help Me approach. So improving public health. So we're going to go to Massachusetts. In the fall of 2013, I was listening to Sanjay Gupta on CNN, and he told of a story that I was so impressed with. He told of a story with the background being that between 2002 and 2013, heroin-related overdose deaths had quadrupled. And in Massachusetts, at a population in the town there of 30,000 people, in May of 2015, they had their fourth fatal drug overdose, surpassing the prior year total. And the sheriff there said that he had had enough. He had never gone to the sheriff's department's Facebook page, but he moved on to the Facebook page and wrote this: any addict who walks into the police station with the remainder of their drug equipment or drugs and asks for help will not be charged. I've never arrested a tobacco addict, nor have I ever seen one turned down for help. So let's go through the intervention tools that he did. I'm using the 4 Ps for those of you who recognize this. The product they offered was medical care, detox treatment, Narcan for overdoses to those people who came into the sheriff's station and into the police department, no questions asked. The services were free. They reduced a lot of red tape so that they could get these services. They were also able to get Narcan at drugstores with no prescription required. And they, again, promoted it on Facebook, and they branded the campaign Help, Not Handcuffs. It's interesting. I thought when I saw that, I wonder if they'd seen that curve. I doubt it, but I was just delighted to see that they actually even used that term in their brand, Help, Not Handcuffs. The results were that 30,000 people liked it pretty quickly. It was viewed 2 million times by the time that Sanjay Gupta reported on it. By the way, I'm sorry, that was in November of 2015. It was viewed 2 million times. 3 months later, 145 people had come to that police station. By December, 300 had come, so that was 6 months later. It's now moved on in 40 programs in 9 different states. So that was the Help Me approach for heroin addicts. Now we'll move on to increasing public safety. The problem. November 2014, our state of Washington got a #1 ranking that we weren't very proud of. The ranking was that we were #1 in property crime in the United States for the year actually for 2013. That's our governor there on the right. At the next day, at a Rotary Club meeting, that's me there on the right, our chief of police, who belonged to the Rotary Club, stopped me and said, Nancy, can't social marketing do something about property crime? And I said, yeah. And I've always said that here in the city where I live that I would volunteer my social marketing expertise. And he said, well, would you come down and tell us what we should do? And so the next day, I went to the police station, and I met with the team there. There was the police officer and a couple of detectives and their communications person and the chief. And we went through some of the key decisions about a social marketing campaign. So I said, well, what's going to be our purpose? Well, we want to reduce home burglaries. At that time, we were having 1.5 a week here in our town, which has about 9,000 homes, 27,000 people. The focus was going to be on actions residents could take. So it wasn't about increased enforcement. It was about what actions can residents take. So the target audience were the residents living here on Mercer Island. And the behavior that we wanted, I thought there was another slide in here, sorry. But so then when we decided that was the target audience, I said to them, I would really like for you to give me all the data on the last 5 years of home burglaries. I want to know, when did people, I'll show the next slide here, sorry. How did they get in? What was where did they get in? Like, was it a door? Was it a window? How did they get in? What did they take? I wanted to know what day of the week it occurred. I wanted to know what month, time of day, address. I wanted to know all of this stuff. And so they gave me this stack of papers, and I went through this because what I was really looking for was something that would inspire me to suggest to them what behavior could these residents take that would help. And I'll never forget the night after I was going through these. It was like 9 o'clock at night, and I pressed the total button on my Excel spreadsheet, and I learned it said that 41% of our burglaries in the last 5 years, there was an unlocked door or window. No one was home, and 65% were during the day. It was that 41% that I thought, my gosh, the behavior is simple, doable. When they leave the home, they need to lock the door. So we refined the target audience to be those who are usually away during the day or week and don't always lock their doors or windows. We did a survey using what's called here, I don't know if it's where you guys live, but we have a group called nextdoor.com, which is, we can use SurveyMonkey with them, because I wanted to know more about the barriers for not locking the doors. The major barrier was that they felt safe. It is a pretty safe feeling kind of an island, so people just felt safe. The other barrier they had was that they forgot to check. And so the motivators, asking them, well, what could someone give you or show you? What would motivate you to do this? Well, show me some data that we've got a problem. Share with me some real stories that this is really happening, so make it real for me. Help me remember. And if I hear this from the police department, I'm going to be much more likely to think this is credible. So we came up with a brand called, we branded it Lock It or Lose It, and it was branded by the Mercer Island Police Department. And what we did was we sent out to all residents of the island, 9,000 I believe, we sent out this little door hanger addressing the barrier of, first of all, addressing the barrier of forgetting to do it. Secondly, if you look on the right there, addressing the barrier of that they didn't think was a problem. So with the messages there that almost half of Mercer Island burglaries involve an unlocked entry, most happen in the daytime. Unoccupied houses are 80% more likely to be targeted, and there are 1 to 2 burglaries per week on average. We also following some of these things that would motivate them, we got our local newspaper to actually start printing in the newspaper detail about the burglary. A 56-year-old woman said that unknown suspects had burglarized her residence and stole about $3,000 worth of items. The point of entry appeared to be an unsecured kitchen window. And then they launched the campaign on the front page of the newspaper. So I'm going to go back here and just I do not have results of this yet. We are going to be doing another SurveyMonkey soon to find out how many people actually use this and whether it made a difference. But I just wanted to talk about how it can be used for property crime. The third thing let's go to now is for protecting the environment. And the problem trying to solve here is that 76% of our nation's workers drive alone, and the impact is on the economy in terms of congestion, the environment in terms of air quality, and health. And one of my favorite cases that I've read about for this was in Portland, Oregon. And they've been there since from 2011. The strategy has been there until now. And what was brilliant, I think, about this solution was the target audience. They targeted new residents, an audience that is identifiable, ready for action, and they defined them as those that had moved there in a city within the last 6 months. And they were able to purchase their names and addresses, a really powerful target audience. And the behavior they wanted was for them to use alternative transportation. So looking at their strategies there, so their products they offered 4 major options and lots of information about them. They offered a walking option, a 10-toe walking kit, they called it, biking, the Portland Bicycle Kit, transit, schedules and tracker cards, and driving, info on car sharing and carpooling. All of these program materials with very detailed information on all of the different options and the routes that you could go were free. And what they did was they sent out an initial postcard. Then you could go online to indicate what you were interested in, or you could also send in an order form that was attached to the postcard and mail that back. I thought the postcard was really cute with, "So we heard you're new to the neighborhood." Here's one of the best parts. So they come out to that residence. They let them know they're coming. They come out to that residence, deliver the product, including all of the information about the options that intrigued them the most, that they were most interested in. Their control groups and their studying about this were really very rigorous. The outcomes compared to the control group were that the group that got these materials had 200 fewer miles per new resident per year, and that they had a 10% reduction in the drive-alone trips. So just a sidebar here, the stories that I'm telling you are stories that are issues that our policymakers are dealing with, if not on a daily basis, on a weekly basis, that they're either concerned about or they get complaints about. And so these stories are examples of the kinds of things that I'm hoping you, my fellow social marketers, will be inspired to find your own versions of or to share, the Help Me approach. So on to the next one, engaging communities. So a problem that really always troubles me, because I'm just a dog lover, is increasing pet adoption. And so this program has been going on since 2004. The problem that we're looking at here is that every year 2.7 million dogs and cats are euthanized. And from what I understand from many of the experts that I've talked about this, these are not dogs and cats that are particularly ill. They're not necessarily particular behavior problems. They are abandoned or brought to for some reasons that some kind of a lifestyle may have changed. So these are adoptable pets, many of them are. So the typical barriers to adoption are, I don't know what I'll get. oh, that application form is just too difficult. I don't really know much about adopting. And, oh, I want a purebred. And I'm not so sure that they'll have the dog that I want. The solution is a product that was developed by the American Society for the Prevention of Cruelty to Animals, by their executive director, who, kind of like that sheriff in Massachusetts, had enough. We've got to do something about this. It was branded Meet Your Match. The product was, the core product, like the whole benefit here was saving a pet's life and a companion. The actual product was assessments. And so there was a caninality assessment and a felinality assessment. And so the way it worked is that you would go online, or you could go into the shelter, and you would take a questionnaire probably similar to like Match.com or eHarmony, where you answer a bunch of questions about the kind of a dog or a cat that you want. And then what they do is they assess the animals that are in the shelter, and they categorize them the same way. So essentially, you're categorized in one of this, and here's the categories. So these are categories for the cats. You're either a private investigator, a secret admirer, a loved bug, an executive, a sidekick, a personal assistant, an MVP, a party animal, or leader of the band. So you personally, you the human being, are put in one of those categories based on what you said you wanted in a cat, and the cats that are there in the shelter are observed by the staff over a period of time, and then they are categorized as being one of those. The assessment itself, in terms of price, there's no fee for the shelters to use the program, and there's no fee for the potential adopters to take the survey. As I mentioned earlier, you could either take it at the facility itself, or you could take it online. Key messages were things like you could be gazing at the animal of your dreams. The Meet Your Match program wouldn't let you go home without knowing who's in that carrier or on that leash. This is the only method in existence today that evaluates an animal's behavior and interests and matches them to an adopter's preference. And the results were that in participating shelters, there were some that just got 15%, but there were some that had 60% gains once they had adopted this program, where you really found something that was a great match for you. So I just really think it's a fabulous product intervention. So now we'll go on to another category, a category of enhancing financial well-being. So the problem, we hear about this probably daily. I know I do in the news. And in 2015, almost half a million people homeless on a given night. That's just not like in one night about that many people are homeless. The annual taxpayer cost is between $30,000 to $50,000 per person per year on costs related to care and all the other kinds of things that happen with those homeless people. Barriers to people getting the housing is availability, the cost of the housing for taxpayers as well as the individuals. And I recently heard from our sheriff here in our county that one of the problems is that in order to get into those shelters, you have to agree not to use drugs, and you have to agree to accept and go right into rehab services. Those are barriers for a lot of people. A lot of people don't think they can do it. A lot of people don't want to do it. And so those are the biggest barriers to some of the people, especially the chronically homeless, to actually even applying for housing. This barrier, let's look at it as a cost, did not match the benefit for them. They didn't want to give up their drugs, and they didn't want to jump into rehab services and mental health services. Salt Lake City tried something new. What they did was they had 2,000 chronic homeless, and they did a program called Housing First. They took those barriers seriously. What they said was that you could use drugs. You could not be a dealer, but you could still use drugs there. You did not have to agree to the services. They knew that could come later. That could come later when, as we take a look at some of the states of mind and we look at the hot state versus cool state, or the rational versus irrational. it would probably, once they're in their shelters, they're going to be more rational. They're going to be calmer, and they might then agree to these services. They had a goal to end chronic homelessness, a big goal. By 2015, they dropped by 91%. So from 2000 and 2005 to fewer than 200 in December of 2015. I say the brilliant thing there was understanding the barriers. So other cities now have tried the same kind of a program. They're actually able to look at the cost of doing this drugs by over 2 years and these costs alone, so pre-entry and post-entry. So many other cities now are looking at this model and saying, wow, you know what, this would still be a good return on our investment. The last category we'll take a look at here is the category of academic performance. That's another one that I know policymakers care about, and that social marketing can make some contribution to. The problem, 30% of high school grads do not enroll in college. That's on average. In San Marcos, Texas, more than 60% were not enrolling in college. Many of them were low-income Hispanics. This is data from 2004. The solution, it was a brainchild of a local school official who says he was inspired by Nudge. And people who got used to the program said, man, this was faster than a UTIP clip, that this could work. What they did, they made it so like to complete college, they made it a standard for high school graduation to complete the college application. Okay, so if you want to graduate from high school, you just got to at least fill out a college application. And they got help with completing their application, especially from this nearby Austin Community College, which was a major partner for this effort. Price, the counselor stressed how much more money college grads would earn and how it could help them get a cool car. They understood their target audience. And the admission exam was free of charge. The place, the counselors and the exams, the counselors would come to the high schools and they would help them do the applications at the high school. They would also even give weekend sessions for the parents that they could get involved. The results from 2004 to 2005, the percent of San Marcos high school students who went to Texas College rose 11 percentage points. So they went from 34% to 45%. And it's been adopted by other communities in Texas, in California, and Florida. So really combining a couple of behaviors at once, but also providing I suppose you'd call it a stick if they're not going to graduate without enrolling, but it's also a carrot. So as I looked through all of these, I made a little list of the things that really help, because this is all about social marketing, and this is about social marketing. How do we help? Well, we help with products, like recovery treatment for heroin addicts, like Meet Your Match program, like door hangers, and helping fill out college applications. We had prices that helped, like no requirements for being drug-free or agreeing to treatment in order to get housing. Places that helped, like delivering transportation options to homes, weekend info sessions for parents on the college apps, and then promotions that helped, social media for help, not handcuffs, and our lock it or lose it memorable slogan. So I want you to return now to who you are, as I understand you're being social marketers. I want you to go back to being that now. Get out of the policymaker shoe and roll. And I want to just advocate and just, I'm going to say, please plead with you to help spread the word about social marketing to elected officials. We did that here in the Pacific Northwest, and I think it was a great success. Our Social Marketing Association did a gallery exhibit in our capital, in the legislative building of our capital. We got an editorial in the legislative newspaper, and we got a radio interview that spread the word to policymakers. So here's a picture of our capital here in Washington State, and what we were able to do was we were able to get banners that hung all around the rotunda that explained what is social marketing And then we also had 4 success stories that were Washington State success stories that actually used social marketing. One was for the Department of Labor and Industries. One was reducing tobacco rates, and we showed the results. And these banners were like, I want to say like 3 feet wide and 6 feet tall, and hung in, like I said, major areas right outside the places where the legislators are. And then a pedestrian safety one, and one for fixing oil leaks. So we picked one from the environment, from injury prevention, from health, and the community. And then we also put this one up there so that they could get a sense of this other option that they've got for getting people to change their behaviors and using the social marketing approach. So I think that I'm at my end time, you guys. So I'll come back here and see if you have any questions, and I'll turn it back over to you, Jay.
Sure. Thank you very much, Nancy. Perhaps you could talk us through a little bit while we're waiting for people to put in their questions, he says to the crowd. Can you tell us a little bit about what you put in the rotunda there? I guess that's just what you went through with us.
Yeah, those 4 banners. These were the banners that we put. We put this one to. We also had one that gave a definition of social marketing, and then we did this so that people could understand how it relates to laws and how it relates to education. And then these were the case studies, basically success stories. These are 4 separate posters.
And how long did that stay up in that area?
It stayed up during the legislative session. It stayed up from January all the way through April.
Oh, wow. They were able to keep a permanent exhibit, if you like.
Well, it was during their whole legislative session, and I just got word today that they are welcoming us back for next year.
Well, congratulations.
With 4 new case stories. So we're going to find 4 more social marketing success stories here in Washington State, and we're going to create 4 new banners for them, and we'll put them up there for display.
Great. Okay. Can you run through for us when each of the 3, you talked about the 3 segments, if you like, make me, help me, and show me.
Show me.
When is each of those, tell me, yes. When is each of those the most appropriate?
Okay, well, I'll start on the far left. In fact, is it okay if I put up that slide while I talk?
Sure,
okay.
Absolutely.
All right. So the show me approach is very, very appropriate when there's a behavior that's new in the marketplace. Something like when we discovered, I don't remember exactly the year, but when we discovered that that an aspirin given to babies and toddlers would cause Reye syndrome. And so when that message got out, it was adopted very quickly. And so when something is new, so technology may find something new for us, and we get it out there with a simple, this can cause a serious problem, don't give your babies aspirin. So something new in the marketplace that's fairly easy to do, and the benefits are really valued, education makes a lot of sense. And the problem is that doesn't happen really often. But once it was for something new that's easy to do, the value's there, that was when it makes sense. Second thing, social marketing is when it's the largest segment, that among, let's say that there's a behavior that's out there, and you look at the people that are not doing the behavior. So assume right now that curve is the people who are not doing the behavior. The largest group are the people who say, well, it's not a bad idea. I'm not against it. I haven't decided I'm going to do this. So when it's a large segment, when the show-me's, the show-me's are already doing it. When the barriers that they share that they have are ones that we can probably address, when their benefits are ones that we can probably deliver. When, from a government perspective, when we've got agencies, be it the Department of Transportation or the Environmental Protection Agency, when we've got agency that we can leverage their services, then it makes a lot of sense. And when positive return on investment. The Make Me approach wouldn't apply to the slide that's in front of you right now, but I was involved in a Make Me approach when I did about 2002 when we looked at people wearing seatbelts, and we had 82% of people wearing seatbelts and 18% of people not wearing seatbelts. The only people left are the people that you'd have to make do it. So we passed a primary law and increased the fine. So there are times when it would be, the Make Me approach is when all that's left are the people who are not going to do it unless they're Make Me, or they're the largest group. That answer, that's
sure.
it, Jay. Yeah.
Sure. Okay. Thank you. We have a question from Leslie Maxwell. Can you describe your process for defining and designing the product, and is it a collaborative effort, or when is it a collaborative effort?
Wow. Well, yes. Here's my thoughts about designing a product. First of all, the inspiration for the product, everything about it, comes from the barriers list. Because what we do is we take a look at, well, what are some of the reasons that people aren't adopting a pet? And so when we take a look at that and we find out one of the barriers is, I'm afraid I won't find the kind of dog I want, or I don't know what kind of dog I'm going to get. The process is, okay, then so now that we've got this barrier, we say, what kind of a product could we develop, be it a service or a tangible good? What kind of a product could we develop that would knock down that barrier? The team that would be putting this together would probably be a team of, let's say, it might be a person who's in the communications area, it might be a person in the research area, it might be a person who is actually a program manager or a director. He said, okay, so I wonder if we could find some way to do something. So they might brainstorm another way to do it, would be to do a little more research with motivators, with the target audience, and say, what would make it more likely that you would feel comfortable adopting a pet? And then they might say something like, well, if I knew that they were like me, if I knew that they were something like me. So our inspiration for that then would come from the target audience, giving us more specifics about what are some of the features of such a product that might be like that. So for me, the inspiration comes from the audience, and then the actual development of the product comes from a team that is exposed to this research and actually has some skills for product development. Maybe we have to end up going to a company for the product. Maybe it's a kiosk that we want for recycling. So there may be the actual development of the actual good or service, be it a quit line for tobacco, may come from people who are expert suppliers in that field. But the ideas, I think, should be explored by a team of social marketers and then learned, and then they guide the development of it by suppliers when needed. I hope that addresses a little bit of it, Leslie.
Does that change depending on the level of product you're talking about, Nancy? You talk about 3 levels of product.
Oh, no, I would say the core product is simply what you learn when you ask people to benefit, the WIFM, the what's in it for me to do this. So I've just always learned, Kotler's a big fan of the product platform, which says that you want to make sure when you develop your product platform that you understand what's in it for the customer to buy this product. And it's more of a message implication than it is an actual tangible object or good implication. And the augmented product are extra little things that you do that are above and beyond maybe the Meet Your Match program. It would be staff following up with you a week later saying, so how's it going, everything working? So it would be the bells and whistles part.
Great. While we're waiting for more questions to come in, I have a question for you. You're talking about what you're doing with your association to get something local happening where your legislators see what social marketing is about and how it fits in. And you've given us an example of something that other people could be doing elsewhere. Do you want to talk a little bit about the process of organizing to do that locally?
Well, first of all, you have to go through a real application process. And we learned that it would be more likely to be accepted because they'd get a lot of requests for things like that. You can imagine all the advocacy efforts. They said that it would be most likely to be accepted if it came from a government agency, not from a nonprofit organization. So then I basically got the school where I teach at the university to be the sponsor, to be the one who was actually asking for the making the request. So it didn't actually come from our local social marketing association. The request came from the university. And in that way, and I understand where the legislature's coming from. If they'd opened these doors up to all kinds of organizations, there would be a waiting line. So this made it a lot easier. So that was the key to success, was understanding. And then we just had people who work in Social Marketing Association. We have an ad agency that did the posters and created those and helped us, put them all up. They're also part of one of them's on the board of our local association.
And you do have this local association, the Pacific Northwest Association.
Yes.
You've helped grow.
4 years.
Great model. We have 2 questions have come in now. First of all, from Christina Burns, what would be an effective method to determine what percentage of your audience falls into the show me, help me, and make me categories? And I'm going to tag onto that another question, which is, and does that change over time, or do you find it's pretty constant?
Absolutely changes over time, because you're going to get some people who are going to adopt it. So going to the question, in the ideal world, you do a very representative, quantifiable survey. And when it comes to things like, do we do a primary seatbelt law, I think that governments are ready to pay that kind of thing, to do a citizen poll, to find out. So, but basically it's a poll, and you would be asking people, how likely would you be to do this? And then you would look at the number of people that would be very or somewhat likely. Then you'd get the people that, no, I doubt very much that I'd be willing to do this. And then there would be people who would never do this. I can't remember, I'm sorry, I can't remember how the verbiage would be there, but it would be either on a scale, or it would be using words like never, maybe, not at all, or yes, maybe, not at all. You could even use that kind of a framework. And then you would get the percent in each of those categories. And so I would say when something is new, you may have a bunch of people that, among the people that aren't doing the behavior, you may have a fairly big just show me group. Oh, wow, that's a great idea. I'll do that. But as time goes on and you look at the group that aren't doing it, then there are going to be more of them that are the help me's. And then once you've got a lot of help me's, let's say you're 10 years out there, you're going to all that's left who haven't done the behaviors, particularly something like texting and driving. It's going to be the make me's. And so it's done by polling, ideally.
Okay, thank you. And a question from Ray Belcourt. How could you use social marketing to get policymakers and city residents more comfortable and open to talking about and considering taboo subjects, such as safe injection sites for injection drug users?
Wow, which I think should be explored, by the way. How could you use social marketing to get policymakers to be more comfortable? Well, I don't know that we'll get them to do that. But there are people in communities, like in our community, we have a guy who does a whole lot of citizen polling, and the legislators listen to those citizen polling. I don't know if that would be a way to do it, and I'm sorry I don't feel like I'm answering that question. How would I make them more comfortable to talking about and considering taboo subjects?
Well,
Okay.
Could you, for example, have them come together, have a discussion
Yes.
forum of some sort where they start to get comfortable discussing it in a safe environment before they have to
Right.
do it more formally?
Yes, with constituents. Yes, yes. I will say that I asked the mayor of Seattle 2 weeks ago. I said, I know that you're struggling. It was at like a city club meeting. There's only like about 40 people, and it's like They do a monthly cocktail, and they bring in city people. And I said, how have you looked at the Salt Lake City, what they did? And he said, yep, I've looked at that. Problem is that they were funded by the state government. And so we need our state government to fund this to have a program similar to Salt Lake City. So I guess I think that maybe it might be easier than maybe we think to bring up some of these subjects. I don't know. I'm afraid I probably haven't addressed that very well.
If anyone else has suggestions is on the line, feel free to type your suggestions in as well. Maybe you have something to offer, Ray. We have about another 4 minutes left for questions if anyone has any before we're going to wrap up the webinar. Anything that you'd like to add, Nancy, at this point?
No, and at this point, and I've just reread the question there again, and I know that I've attended here on Mercer Island, when there are really controversial things, be it about homelessness or tolling on the roads, our community center often hosts community events where they will have elected officials come and listen to community input on things. And that may be a very basic thing, but that's something that I see happening a lot.
Nancy, this is when I'd also suggest that people look into citizen polling apps. For example, there's iCitizen, I think it is in Europe, and there is. You mentioned that there's Nextdoor.com that is becoming very popular in the United States.
Yeah.
We're using it in our neighborhood of about 18,000 people here in Maryland to ask questions, just poll people about health issues, poll them about how long did it take you to vote in the election. Do you think it's okay for people to block the sidewalks with their cars? And it's generating, first of all, a lot of interest and participation by people in the neighborhoods. Yeah. We've got 13 neighborhoods of 18,000, but also the local police department and the Montgomery County Legislature now are monitoring our Nextdoor accounts, so they're picking up on what's happening as well. So.
Yeah. And we haven't used an app, but the SurveyMonkey we did was just simply an electronic that went out on Nextdoor, and people just clicked on the link and filled out the SurveyMonkey. So I don't know about the apps. That's great.
And I would say as well that norm appeals can be very important in an area like this in two ways. One is if these policymakers find out about their peers, people in other administrative areas like other locations where they're doing it and it's working, and they hear about it working well for other people, then it becomes sort of more of an accepted kind of thing that they would consider. And on the other side is the political outfall. If you can at least show support in the community, sufficient support for something, then they're going to feel more comfortable, wading into those kinds of discussions, or even. If you can show that people want to have those discussions or are interested in these outcomes, they're going to feel much more comfortable too. So it's raising the visibility of people who are really supporting them in doing that.
Yeah.
Well, okay. I think it's time to wrap up today's webinar. Thank you very much for a wonderful way of organizing it, Nancy, that you're helping us in the field to see social marketing in this ways. Is there one last question here? Humphrey Machiri. Sorry, Humphrey. You haven't asked another one today, so I'm going to try to fit it in here. It seems most social marketing strategies require resources. How would one influence resource allocation where problems such as smoking cessation are not a priority, such as food distribution?
So I would have another question before I could answer it, but food distribution, are we talking about maybe like getting food that doesn't go to the landfill, that it goes to food banks instead, do you think? See, I don't
You can
know.
type that in, Humphrey. She can answer about that.
So if I assume for a second that it really was that, what you do is you talk about the landfill impact, the impact that food is having on the landfill that could be distributed by food agencies. So maybe while he replies, I'll go up to Christina's comment about on cost effectiveness. I didn't get into it in this webinar, but I have written articles as well as one of the chapters in this book I'm writing for policymakers is all about how this is often the greatest return on investment. And the way that we do this is that we calculate what it costs us to change one behavior. So we look at all of our outputs and what did it cost us to change one behavior. And then what we do is we identify the value of that behavior. Like, what did that save us in terms of taxpayer dollars? So with that, it's a bit of a dream, it's a bit of a stretch, but that's the answer to that, is that we need to do more of that. And I am seeing some of that being done now, where we actually say, what did it cost us to get one more person to do this behavior, and what did we save by getting a person to do that behavior?
So the question, I think, was elaborated on. Ray's really saying, in the developing world where you've got all these other priorities, how do you get resources for focusing on things like that?
Yeah. Well, I guess I think you do it through things like the Gates Foundations and PATH, and you do it through organizations like that have decided to take on everything from polio to mosquito nets, and because I know that those are the wicked problems there. But maybe what he's saying is, what if it's not a wicked problem in those places? And how do you get resources for things that aren't a wicked problem? And I think the only thought I've got is to somehow get an economic value for it, to find an economic value for it, so you can justify the resources.
You know, I think Humphrey is working in Zimbabwe, I think he's in Zimbabwe, which I'm very familiar with. Nancy, I work with, and there are resources for social marketing for smoking cessation. But as you say, you've got to know where to look. It's like the CDC Foundation and George. You can look at George Bush's organization as well, and also the National Cancer Institute here, which does some international work. But there's a lot of competition for the resources. Absolutely right.
Okay.
Well, thank you so much, Nancy, for today's webinar.
You're very welcome.
Trying to advance. Here we go. I'd also like to thank the participants for joining us. And as you leave the webinar, you will be offered the opportunity to fill out a short evaluation form. And we depend on your answers when developing our webinars. Otherwise, we don't know what you like and what you don't like. And so please do fill that out if you would. Doesn't take long at all. Our next webinar in this series is Qualifications and Professional Standards in the field of social marketing and behavior change. Should we have them? And there's a proposal going forward from the European Social Marketing Association, possibly from all of the associations together, that will look at how we can make use of existing training programs and add our own mark onto it with certain other criteria being there as well. You can read a little bit more about this on the ISMA website. We've opened registration, and there's a little description of what they're going to be talking about if you want to stay current with that next wave in social marketing professionalization. I suggest you join us for this next webinar in our series, which is coming up in January the 31st. And why am I there? There you go. I'm going to turn it over to Wynn, saying, as usual, thanks so much, Wynn, for helping to organize these and making them work. Over to you.
Jay, thanks. It's a pleasure to be part of the webinar today, and you always make it seem easy, but I know you spend a lot of time on organizing the program, and we really do appreciate it. Nancy, thank you for this presentation on social marketing for policymakers, the Help Me approach. And thank you so much for coming back for another webinar after your first one, which was on corporate social responsibility, which is in our archives, I do remember. And that you can see that and all of our other webinars through the webinar archive of ISMA online. So Nancy, thank you so much. This has been great to have you here.
Thank you.
And to our members and our participants in today's webinar, thank you for your continued support and your participation. Look, we hope to see you in our next webinar in January. We've got Matt Wood and Philip Holden of the UK on professional standards in the field of social marketing and behavior change. And until then, keep visiting the ISMA website, share your events on our calendar, and do keep up with our Career Center, which now is up to date and really showing some great jobs, at least in North America for now, through the ISMA website. So do take a look at it and do put in your resume so our recruiters can find you if you're looking for a job. Until then, keep visiting, share your events, exchange resources, and we look forward to seeing you again. This is the International Social Marketing Association. We now conclude today's webinar.